Good afternoon, ladies and gentlemen. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council. Our webinar is beginning. We want to thank you so much for joining us for this educational webinar that's hosted in coordination with 6SigmaTek, an associate member of the DFW Hospital Council. Today we're going to be discussing Lean Six Sigma Yellow Belt Training. It's a virtual online course that'll be offered this year to hospital members. The Six Sigma Yellow Belt certification is aimed at those new to the world of Six Sigma who have an interest in developing skills involving teamwork, data analysis, and problem solving. The certification course adopts the approach of advancing the concept and potential of Six Sigma tools and methodologies within an organization. We're delighted that Patty Taylor, the Director of Quality and Patient Safety in our foundation, hosted these courses for several years in association with 6SigmaTek. And Patty's with us today. So Patty, can you comment about your work with 6SigmaTek?
Sure, Steve. Thanks, and thanks for having me. As Steve said, I am the Director of Quality and Patient Safety at the Dallas-Fort Worth Hospital Council Foundation, and I have had the pleasure of working with Stephen Griffin since 2017. It might even be 2016. We were able to host 5 classes of yellow belt. We also did some green belt classes as those people graduated and moved on to the next level. And it was an amazing experience. I actually participated in one of the classes and do have my yellow belt, thanks to Stephen. And I have to say all the hard work I put into it too. His classes really are very beneficial. They make you look at the processes and use the tools properly. We were able to have 130 students over those years actually graduate with their yellow belt, and we had graduation ceremonies and everybody was super excited about it and their certificates. And I went back and I looked at some of the comments from the events, the evaluation comments, and I just want to share some of them with you. So some of the comments were simply brilliant. The instructors were very accessible, great class. It provoked critical thinking, and the instructors helped you think outside the box. I think some of my favorite tools that I took away from getting my yellow belt was the Gemba of walking around. I love people, and so that got me out of the office too, to be able to walk around and really see firsthand what the issues are, because you always think you know what they are, but that's the whole point of Lean Six Sigma, is to get down to the root cause, what is really the barriers that are out there. And then my other favorite one was the spaghetti diagram, which shows inefficiencies. And when you put that down on paper, it is amazing how far away that storage closet is from the nurse's station. You never really realized until you see it mapped out on the piece of paper. So I just wanted to share that all of our students really got a lot out of the Six Sigma yellow belt classes, and Stephen is a great, very energetic trainer, and you will get to see that shortly. So I'll turn it back over to you, Steve.
Thanks so much, Patty. Appreciate that great feedback, and I think that helps set the stage for our speaker today, Mr. Stephen Griffin. He's the CEO of 6SigmaTek, and during his career, which has spanned 2 decades, Stephen has mentored over 2,000 Lean Six Sigma yellow belts and over 700 Lean Six Sigma green belts. He has also trained over 75 surgical and emergency room residents at such facilities as Our Lady of the Lake Regional Medical Center, which is located in Baton Rouge, Louisiana. And through the work, saving hospitals and companies over $190 million through continuous improvements. We're really looking forward to your presentation, Stephen, and so it's my pleasure, ladies and gentlemen, to present to you Stephen Griffin.
Wow, that's amazing. How you guys doing? Hello, family. Thank you, Steve. Thank you, Chris, and thank you, Patty. For a minute, I had to ask, who are they talking about? So again, I'm Stephen Griffin, and as you know, depends upon where you are. My name is Stephen or Staven, and so Staven is here to talk to you today. So you've seen my face. You can see I got a little gray these days. COVID aged me, and so what I'm going to do is take myself off before I scare you half to death, and then we're going to go right into the presentation. All righty. So hold on. Let's see. All right. So we're gonna. Okay, Mr. Chris, I'm trying to advance it. Let's see. It's not advancing.
Hey, Stephen, put it down there in the left-hand corner, and you'll see the tools come up.
Oh, there you go. I got you. Gotcha, sir. Thank you. Okay. All right. So the course objectives. Before we even dive into that, let me just kind of talk about what this course really is about. So, of course, right now, we're all going through COVID. And, you know, if I look at COVID, it's horrible. It's horrible, and everyone is affected by that. And at the end of the day, it's still about the process. COVID is an issue. We handle issues with our internal processes. Today, and you guys know this, now the patients have the right to ask any hospital up front, what are all the costs that I'm going to incur or they're going to incur if they come to your facility? So these patients now, just like yourselves, we are consumers of health care. So we can pick and choose where we want to go. Maybe not the case in regards to COVID, and I'll tell you why I'm going in a minute. But the point is, what makes a hospital more attractive than the other? Is it the outcomes, or is it the process? The answer is yes. If I can pick and choose where I want to come to gain services, and if cost is one of my critical to qualities, then I'm going to go to the best cost and the best outcome. And what makes up the best outcome is the processes. And that's what this class is about. This class is about empowering people to affect the processes in real time, not walk on the unit and say, I wish we could do this, or I think we should do this. It's actually giving you the power to do exactly what makes common sense for that patient and for that hospital. Okay, so some of the objectives that you're going to learn the fundamentals, you're going to learn the background, you're going to learn basics. Of course, you're going to learn what the DMAIC methodology is. And for those that don't know what DMAIC is, Six Sigma has 5 phases: define, measure, analyze, improve, and control. Define the problem. Measure the problem, analyze the problem, create solutions to improve the problem, and maintain the solutions by control. So that's what DMAIC means. You're going to have to complete a project charter. You can't start any project without a charter. It's a statement of work. You're going to become what I call transformationalists. You now will have the ability to speak out. Your voice matters. Not saying that it didn't before, but now you're talking specifically, not like my niece says Pacific. We're talking specific, not Pacific. So specifically, you can now attack certain problems. You're going to be able to incorporate the voice of the customer and the voice of the process. How many times have you been on projects and it's more or less someone tells you what to do, but it's not necessarily what needs to happen? You're now going to have the ability to know exactly what needs to happen because you have that voice of that customer, that patient, the voice of that process. You're going to define an actual business problem. Now, here's a tricky one. I know people don't like politics, but you have to engage the stakeholders. How many times have you had an excellent idea, but you didn't know how to tell Dr. Johnson, this is what I think we should consider? Well, now guess what? Dr. Johnson will be a part of your team. So it's going to be a team effort. All ideas will be vetted as a team. You're going to be going through different departments. It's not going to be a silo anymore. People are going to know what's going on and on first and second shift on that floor. You're going to engage the physicians. You're going to remove all the waste, and we're going to get into that. You're going to quantify the problem. Stop saying, I think this is the problem. I think we should do this. If we do this, we might get this outcome. No, you're going to know 100% of what the problem is, and you're going to quantify it. You're going to create goals, okay? You're going to use the different tools. As Patty said, Gemba is a tool. It's a very simple, common sense tool. You know, if someone tells you, I mean, think about this. Think about it. Everybody on this call shops at Amazon. If somebody says, man, did you see what Amazon had on sale? What are you doing? You're going straight to Amazon to look. That's Gemba. Go to the source. Verify with your own eyes. That's Gemba. If someone says we have a length of stay problem, I don't know that until I go, right? So that's what Gemba is. You're going to go to the source. That's one of the tools. You're going to brainstorm. You're not going to just say, this is the answer. No, you're going to vet out the solutions as a team, and everyone's going to come up with the actual solution that's going to solve the problem. And at the end of the day, you're going to create the control plan that's going to maintain all of the hard work that you put in place to solve the problem, whatever the problem is. Now, what are some of the projects? COVID. The beautiful thing about 6SigmaTek, I have a healthcare group. I'm not clinical, but I can Gemba, right? But I have people on my team that are clinical. And I have a physician on my team and a quality director on my team that actually just implemented COVID processes end to end. Okay, so we have that. We have RNs, we have physicians, we have clinical people on the team that can understand what you need. Lab throughput, OR turnaround time, CHF, sepsis, C. diff, 30-day readmission, falls, call out wait times, whatever. What else? You name it, we got it. And if we don't have it, we'll work with you to get it. Our goal is to make sure that we solve problems in your facility and we help your patients right now, not tomorrow. That is our goal. So to join this class or to participate in this class, you have to come with a project. You have to come with the project. And so what we figured is if your project is going to speak to one of these 8 wastes, if you have a project that's evolved around wait times, bring it. Overproduction, performing too many tests, unnecessary activities, bring it. Rework. If your project is around, we need to reduce the number of times we do this, bring it. Motion, as Patty said, she didn't know from a spaghetti diagram how much walking and back and forth action that took place in some processes. What happens when that nurse or that physician, right, is going away from that patient is left alone. And then what do? You get bad reviews. You know, they go out and they say, I was left alone. Nobody cared about me. Uh-oh, somebody just called Jaco. Oh no, here we go, right? Bring it. Processing issues. Does every nurse, physician do the same process every time the same way? No. How can we reduce variation? If you got variation in the process, bring it. Inventory issues. I'm sorry, nobody hoards anything anymore, right? I can't go on anybody's unit or anyone on this call. No one is hoarding anything on their unit. I know because when they hoard, you have inventory issues. If you got this situation, bring it. Intellect, a waste of intellect. Now this gets kind of tricky. Why would you use a physician or work with a physician when you got a housekeeping problem? That's a waste of intellect. Think about some of the issues where you're involving people that don't need to be involved. That's a waste of intellect. If you have that, bring it. Transportation, right? I did a project once and the whole project was around reducing the time it took to transport a patient from the ED to the fast track. That was a very interesting project, right? But the point was We got to get the patient to the fast track so the fast track can take over. Where it was not a fast track to get the patient to the fast track. Okay, so transportation issues, bring it. Your projects need to address or have one or all of these types of waste. That is what is going to quantify a project for the class. Has to deal with the 8 wastes. This is a process. You're going to get this again because I actually have to change this process, which is rework. So I'm including waste in my own process. So bottom line, you're going to come to this webinar, which you're doing. You're going to obtain a manager support approval to come to the class. You're going to determine the process that you want to prove. You want to make sure that that process meets one of those 8 wastes, at least one. During that time, you're going to go out, you're going to get 1 month of data. 1 month of data. In God I trust. Everybody else bring data, okay? So you have to bring 1 month of data. Don't tell me I think this is the problem with no data. I'm not listening, okay? You're going to register for the class. You're going to complete your project charter as best you can. You're going to send that to me. This is the process step that's going to change. What I'm going to change here, and you're going to get this, is I'm going to create a portal where you can submit your charters, and then you're already going to have your mentors assigned to you. So one of these great, beautiful people I just talked about, you're going to be assigned a mentor that's going to help you, and they're going to work with you on the charter that you created. The charter that you create, and you will get examples, is not going to be perfect. I want you to get started thinking about what is the project. Once the charters are received, you get your mentor. You will be in contact. This all happens before you come to class. We will need those. You will have your mentors, and your mentors will have your first pass at your charter roughly 1 week before class starts. Okay? So if you're thinking about something, once I send you the templates and I send you like a how-to, you will have an idea of how to create a charter. Plus you have access to me via my email and my cell phone. Do not call me on Saturdays. You can call me on Friday nights, but not on Saturdays. All right. After you attend class, to get your certification, you have 60 days to implement a solution post-training. So let me decompress everyone. I don't need you to go out and solve CHF length of stay. That is an elephant. I need you to do the elephant's toenail. This is yellow belt. It's small in scope. If you're working on a CHF problem, maybe you just need to be able to monitor CHF patients better. Your goal as a yellow belt is not to solve world hunger. Your goal as a yellow belt is to bring problems to light and give insight to what the solution will be. Because my goal is to get you guys to go green belt, and then you can solve the problem. 60 days, unless you're just very, very good, very, very good, is not a lot of time to solve world hunger. But 60 days is enough time to use the tools that you're going to learn, be empowered, have conversations, work with stakeholders, break down barriers, and at least say, we're going to do this part for now. When we go green belt, we're going to solve this part. That's all yellow belt is. So please decompress about that. Also, you're going to create a presentation, and you're going to present to your management team, and I will be on there with you, and your mentors, and your mentors will help you build out your presentation. We used to, back in the day, use the 6SigmaTek template, but you can use any template you want. We just want to make sure that you tell the story of success that can be used over and over at your facility. And then we're going to celebrate you as you get your certification. Now, what is the cost? We have 2 options. Option 1, again, everything is virtual. And what I mean by that is you're going to be on Microsoft Team meeting where you're going to have a live instructor. You guys can ask questions, right? And then after that, all of your mentoring is virtual. So here's the first option on the mentoring. If you go option 1, you'll receive a PDF. Your material will be PDF. You can get a hard copy. That's going to be a fee to that, but I can do that as well. You're going to receive all of the Excel templates you need. We have a Yellow Belt toolkit that we're very proud of. You're going to have data sets. So you're going to be working. This is a working class. That's why you need to bring data, because you're going to get a chance to work with your data in class. So option 1, you're going to get 12 mentoring sessions via email only. So basically, you get 12 sessions. Your mentor will say, our first session, you have to complete a charter, a VOC, or something like that. Each session has a to-do. Each of the 12 sessions has a to-do. So every time you come back, we have to discuss, did you complete what you were supposed to complete in our last meeting? So that's 12 mentoring sessions. This is over a 60-day time period. Your mentor will give you a calendar where you can sign up for your 12 30-minute sessions. I'm sorry, email sessions, okay? Also get your certificate and all that good stuff. But the bottom line, option 1 is $550 per person, and you get 12 mentoring sessions. Option 2 is $850. Same thing, you get the PDF. I can send you material. Option 2, you get 6 email sessions and 6 live Microsoft Teams sessions. So you get to get on there. I might be somebody's mentor, so that means you got to look at me 6 times. I know that may be hard to do, but we'll get through it together, okay? So you get 6 emails and 6 virtual live Microsoft Teams sessions, or whatever it is, the platform that you're using, okay? And those will be 30-minute sessions. Again, we will assist you with the scheduling, everything so forth. So option 1 is straight email mentoring. Option 2 is a combination between email and face-to-face. Now, we have a couple of options. I guess we can work this out, Chris, once we get closer to that. We can do a 1-hour class. A 1 8-hour class, or we can break it up into 2 4-hour classes. We know, especially right now, everyone needs to be where they need to be in regards to COVID, and we understand that. So we can break it up accordingly. So these are the 2 options for the class, right? And again, implement a solution 60 days post-training. Each person is expected to work hard, and I don't think that that's going to be an issue. Utilize all your mentoring sessions. Again, I have some incredible people on this team. They can help you. As a matter of fact, they can probably give you solutions very quickly. Okay, so you might not even need 60 days. Okay, each person must consult with their mentors. When I say be transparent, if you come into this class and you know, I'm going to be taking PTO in 2 weeks, please tell your mentor that. Please tell your mentor that. If you see that you're not going to be able to make a session or maybe even complete the program, please give your mentor a heads up. These mentors are real life healthcare employees, and they do me a favor and take time out of their day-to-day. All of these mentors actually work for health systems all over the country. So they have real jobs just like you. They take time out. So they are basically saying, Steve, you got me. I'm ready to go to work and solve problems for you. And I love that and thank God for them. So just make sure you take care of them and be transparent with everything that's going on. All right. So other things that we offer, you might not want to do the yellow belt. Guess what? You may have an immediate need right now for something else. We do ED flow, lab optimization, OR flow, Malcolm Baldrige consulting, and much more. We also do, oh my God, what is that called? What is that called? When you get the award, oh, I can't think right now. But we do a lot more things besides this. So just letting you know, if you don't need yellow belt and just some help, we can do that as well. Now, here are a couple of FAQs that's come up over the years. As Patty said, we've been together 5 or 6 years. It's been a wonderful marriage. She's my work wife. I love her to death. And so over the years, we've had a lot of situations come up. So let me kind of talk about some situations, and then we can go deeper into that. So Stephen, what if I pay for training but drop out? Well, fees are non-refundable. You may retake the training at a one-time for a 50% discount. So if you drop out, it's not refundable, but if you come back when we have it, you got to pay half price. Stephen, what happens if I cannot finish in 60 calendar days? Well, we're going to give you a 10-day extension, but you won't get any mentoring time because I just told you they have given me their time for those times. So if you go past that, that means I will probably take you on myself, but your mentor will not mentor you, okay? They have to complete their schedule when they set it. So if this is the situation, I will probably be the one that will work with you doing that 10-day extension. Stephen, do I need to recertify? No. Stephen, is my certification recognized nationally? Yes. Why? Because I teach from the ASQ body of knowledge, and I am a certified master black belt, and I have to prove that. So that's why you're going to be recognized. You know, if I look back to those number of students that Patty mentioned, 100 or so, if I go to any one of their LinkedIns, it's all on their LinkedIn. So absolutely, okay? Stephen, do I have to take a test to attain my certification? No, only in green belt and or black belt. You do not have to take a test for yellow belt. All you have to do is solve the elephant's toenail, create a solution 60 days post-training, okay? That answers this question, you know, as far as, Stephen, how do I receive my certification? I just told you. How many people can be on a team? Well, now this is tricky. This is tricky. I need to evaluate you, yourself, the yellow belt. You can have people on the team as far as on site, but as far as coming to class from a yellow belt perspective, it has to be one belt per project, but that belt can have team members back at their sites. That may be confusing, so I'm gonna see if I can clarify that. You come to class, you have a project, you're the only one working on that project. You're the one that's responsible. You're the one that I'm going to be looking to make sure you get everything done. Your team back at your facility is going to help you on site. So I hope that's clear. Okay. I don't have anything else. I am open for questions, but basically, guys, you can bring any project you want. Again, COVID is the way we're living. I got people on my team that have done COVID projects. They can definitely help you. But COVID, you know, we have other things as well. But if you're looking for a project, then I'm trying to give you some ideas. And again, you have those two options. You have to implement a solution in 60 days. And please, please decompress. It doesn't have to be solve the whole problem. It just needs to be attack the problem, show where we could go next, implement something, and you're good to go as far as certification. So I thank you for that, and I'm open for any questions.
Thank you, Stephen. We really appreciate that presentation, and what a great opportunity to have the yellow belt training courses available virtually, especially in this day and age. That's just a great opportunity. I wanted to let everyone know that we recorded this event, and we will be posting it online, and I will be sending a link to everyone who registered for the event in the morning. In addition to that, today I'll be sending out a PDF copy of this presentation and a form to register for the virtual yellow belt training put on by Stephen Griffin. And the deadline to get those forms back in is Friday, August 27th. Stephen, I don't see any more questions here. If someone, looks like that someone here is asking a question. Hold on.
Okay.
You have a question, just type it in. Well, it looks like I didn't type it in, but what I am going to do is when I send out the email today to everyone who registered, if you have any questions at all, Stephen Griffin's contact information will be on that email. That email will be going out in about an hour.
We have a typo. It's 704-604-9470 instead of 064. It is 604.
I'll send that out, the update out when I send out the email here in about an hour.
No problem. So guys, I want you guys to think about this. What is the cost to your facility to not come to this yellow belt training? You know, Patty can tell you we've had incredible success. We had people to do, I mean, some of the projects that I've done with Patty and the previous teams, some of them will break your heart in regards to the depth and the meaning of that project. You know, it's not always about saving money, but I can truly say that I feel that a lot of the projects that I was able to do with Patty and the team, I think they did save some lives. And I know they did change some minds. I know they did change some processes. And I was always very proud of the opportunity to come and work with the health center and health council, excuse me. And so, guys, you know, this is an opportunity to solve problems, make a difference, and start real transformational change in your hospital.
Great. Thank you so much, Stephen. We really appreciate it. On behalf of Stephen Love and Patty Taylor, we just want to thank you for this opportunity for our hospital members here in the North Texas area. It's a unique opportunity to partake in yellow belt training virtually, and we hope you can take advantage of it. And as I said earlier, we will get that information out to you here within the next hour. So, Stephen, any last comments?
Yes, if anyone, again, if you have any questions that you didn't want to post, I understand. But if you have any questions, concerns, all you have to do is email me. Again, you can call me, leave a voicemail. I'll get back to you immediately. I just want to make sure that you know you're going to be taken care of. We like to make sure that we walk with you throughout this journey. You know, again, we don't have manufacturing people talking about healthcare. We have real healthcare professionals that's talking about healthcare. So I think that's what separates us from most other places.
Thank you so much, Stephen. We appreciate it. Thank you, everyone, for attending today, and we'll be talking with you soon. Thank you.
Thank you.